How does Adderall affect your heart? If you take it, do you have to worry about having a heart attack? That's what I'm talking about today. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. First off, Adderall is one of several stimulant medications that we use to treat attention deficit hyperactivity disorder, or ADHD. Adderall is in the amphetamine class of stimulants, which is different from the methylphenidate class of stimulants. Methylphenidate stimulants are under the brand names Focalin, Ritalin, and Quivalent, just to name a few. In general, the methylphenidate class of stimulants are not as stimulating as the amphetamines, with Adderall just being one of them, but one of the more popular ones. The short answer to this question is yes, amphetamines, like Adderall, do have cardiovascular effects, but these effects may or may not be significant. Let me explain. Adderall, an amphetamine, works to improve ADHD symptoms by increasing dopamine and norepinephrine levels in the brain. Norepinephrine also triggers your sympathetic nervous system, which makes your blood vessels constrict, increasing your blood pressure, heart rate, and breathing rate. If someone has a history of heart disease like atherosclerosis or structural heart problems like leaky valves, or if you're prone to abnormal heart rhythms, then the increased activity of your sympathetic nervous system can put you at risk of a heart attack or stroke. Why? Because you're taking a vulnerable heart and forcing it to work harder, or increasing your blood pressure, which puts pressure on your heart and other organs. So it's pretty standard procedure for your doctor to question you about having a history of heart disease, either personally or having it run in your family before starting you on a stimulant. If you do have any indication of heart disease, then your doctor will probably refer you for further testing to see if it's safe for you to take stimulants. Having a pre-existing heart issue doesn't automatically disqualify you from taking stimulants. It depends on the severity of the heart issue. So that's one high-risk group, those with heart disease. Another risk factor of increasing your risk of stressing your heart is taking too high of a dose. For Adderall, the recommended maximum is 60 milligrams for the whole day. But if you take stimulants regularly, you probably already know that the effects can wear off over time, and then you need to increase the dose to get the same effect. This is called tolerance. Some people can develop tolerance pretty quickly, and some people slowly. If you get to 60 milligrams and it seems to stop working, it's time to switch medications. But not everyone will switch and instead take an extra pill or get their doctor to increase the dose. Or they may take more from someone else. So taking doses upwards of 120 milligrams or more can put you at risk of stressing your heart and shooting your blood pressure up, even if you have a normal heart. The good news is a 2022 meta-analysis published in the Journal of the American Medical Association looked at data that included 3.9 million people. That's a lot of people divided over several studies. The researchers found no statistically significant association between ADHD medications and the risk of cardiovascular events among children, adolescents, and adults, including older adults. And these were people who were taking the medications at therapeutic doses and not the high doses. So that's pretty reassuring to see that if you take it as prescribed, your risk of cardiovascular events is the same as the general population. That article is linked in the description. So all of this that I've just been talking about is about the most extreme outcomes like heart attack and stroke. But what about the lesser effects of increasing your sympathetic nervous system? Even if taking stimulants doesn't cause a heart attack, it can still increase your resting heart rate or your blood pressure. And these increases may be significant or may not be. And here's what I mean by this. The normal resting heart rate for adults typically ranges between 60 to 100 beats per minute. Below 60 is called bradycardia, and above 100 is tachycardia. If you jump out of your seat and run down the stairs, your heart rate may temporarily increase past 100 to accommodate that extra activity. But once you slow down, it should return to something below 100. So what are typical resting heart rates? The less active you are, the higher your resting heart rate. The average resting heart rate for a sedentary person may be between 70 and 90 beats per minute. People who are active and exercise regularly may have a resting heart rate between 50 and 70 beats per minute. And then an endurance athlete will often have a resting heart rate below 60, maybe even like 40 beats per minute, because the aerobic exercise makes their hearts super efficient. So back to the Adderall. It's a good idea to check your resting heart rate and blood pressure before you start taking the stimulant to get your baseline. If you've already started taking the medication, check your heart rate and blood pressure after you haven't taken it for a day or two. If your resting pulse is already low, like 70, and on Adderall it goes up to 75, that 5 beats per minute increase may not be very significant for you. But if your resting pulse is, say, 80, and on Adderall it's now 95, 95 is still in the normal range, but it's pretty high normal. And it may not be such a good thing for you to have a heart rate that beats that fast at rest most of the time. If that's the case for you, all may not be lost. A different stimulant may not have as great of an impact, or lowering the dose may help you as long as the lower dose is still effective for you. As I mentioned before, the methylphenidate stimulants don't activate as many areas of the brain, and because of this, they're less stimulating, but they can still increase your sympathetic nervous system, but they may offer less stimulation when it comes to your heart rate and your blood pressure. So those also may be an option to switch to. The same issue applies to blood pressure, and it's a very individual effect. If your blood pressure is just on the edge of normal, like 120/80, and on the stimulant, your top number goes up to 130 or 135, it's probably not a good idea to continue with that medication. But if your blood pressure is more like 100/65, and on Adderall, it's now 110/70, that's still a good blood pressure. But either way, if the medication causes elevations in either your heart rate or your blood pressure, you should bring it to your doctor's attention so that they can consider other aspects of your medical history and give you the okay on continuing the recommended dose or discontinuing it or switching to another medication. Check out these other videos on ADHD and how stimulants work. Thanks for watching. See you next time.